What I've written in the Harvard Public Health Review is that the Olympics ought to be postponed or moved, not canceled. I don't want the Olympics to go away. I love them too much for that. But the problem we have is that in Rio de Janeiro, that is the heart of the Zika epidemic in Brazil, an epidemic that is thought to have given rise to as many as 5,000 brain damaged babies. If 500,000 visitors, as is expected, come to Brazil for the games, into the heart of that epidemic, some will become infected, some will go home, and that epidemic of brain damaged kids will go global faster and farther.
You mentioned the medical implications there. Why do you think the authorities haven't done enough to inform the public?
Well, of course there's money at stake, billions when it comes to the Olympics. And the International Olympic Committee is saying everything's fine here, but they would, wouldn't they? I mean, they have a financial interest, they're in a conflict of interest. What we know, though, is because of very recent science that has come out in only about the last month, is that the Brazilian epidemic was started by a single infected person bringing the virus to South America. One person. Now imagine the effect of sending 500,000 people into Rio. Some of them get infected, some go home. This is not a risk we should take when all that needs to be done is postpone or move the Olympics, not cancel them.
How close are we to Zika being a full-blown health disaster?
Awfully close. I mean, as it stands today, there have been sporadic cases of Zika reported in 49 countries. This is not something that we can keep bottled up in Brazil. But what we can do is prevent really about 3,000 aircraft worth of people scattering it around the globe. And that is the issue. We can slow down the spread of Zika, slow down the number of these brain damaged children who are being born, thousands already and many thousands more if this goes ahead. That's the issue. And to my thinking, if we can do that by simply postponing or moving the games, that's a question of delaying gratification, not canceling the games. And can we not afford to delay our gratification to prevent an epidemic of brain damaged babies? That's the question.